Today we're going to be talking about the top 3 things that you can do to help prepare for your first psychiatric appointment. I'm Dr. Michelle Haynes.
I'm Dr. Kristen Lassiter,
And we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like around your period, pregnancy, postpartum, menopause, and even infertility.
I think it's important to make this video because coming to a psychiatric appointment can be really scary. It could take a lot of time. And I know a lot of people like to kind of know what to expect or know kind of how to be prepared. And I think this could be really helpful for a lot of people.
Yeah, I commonly hear people say, I'm really nervous for this appointment, or I've, been feeling anxious about this. And I think that that's a really common reaction to going to see a psychiatrist.
Yeah, we ask a lot of really hard questions.
Yeah, we do. And you're about to divulge all this really personal information to a complete stranger. So it makes sense that you're nervous.
Right. Okay. So 3 things to be, maybe just to get the most out of it. Right. So the first thing is to know what your goals are. So this is kind of taking an inventory of what's been bothering you, how you would like to feel, what do you want to be different. Some people's goals are, I just want to know what my options are, including medications or not medications. What could we do here? Some people are like, I want to talk about medicines, or I want to feel different, or whatever, right? So know what your specific goals are, and those could be different for everyone. So just kind of know what you're looking for in the appointment.
Yeah, and voice that during the appointment too. Tell them, hey, I'm coming here because I want XYZ. And then also letting them know what has been most bothersome to you, because I think sometimes that can get lost in all the information that you're giving them. So letting them know, hey, my anxiety is actually what's bothering me the most right now. Yes, I'm also depressed, but I really want to tackle my anxiety first, or, that's what's been most hard for me.
Yeah, I think that's really, really helpful when you know what you're hoping to get out of the appointment, so that we can maybe cater how we talk about things to that. So the second thing that you could do to prepare for your psychiatric appointment is to know about your history. And there's a bunch of things that kind of fall under that one category. When did you first start having symptoms? How have those symptoms changed over time? What medicines have you tried? How did they work? Did they not work? Why are you not on those medicines anymore? What doses were you on?
Did you like them? Were there side effects?
Yeah, those kinds of things. Because we don't want to get through the whole appointment and be like, well, it sounds like XYZ medication would be a great option for you. And you're like, well, I tried that. It's terrible. And then we have to adjust, right? So if we have an idea of, what you've tried in the past, that can be really helpful for us to cater to your specific circumstances, how we talk about medicines and that kind of thing.
Yeah, and this can be a good thing to talk with maybe parents and caregivers about too. So for a lot of patients, these were things that they tried maybe when they were little or in their teens, and so they can't remember exactly everything that was tried or what all the issues were. So it's helpful to have all that information put together before you come to the appointment.
I think it's a nice segue to number 3. So number 3 is to have an idea of your family history. So this would maybe mean talking to your family about what diagnoses they've had and what medications have been effective or ineffective for them in the past. Because sometimes if we know a relative or numerous relatives in some cases respond to a certain medication, we might prioritize utilizing that medication for you if you've never been on medicine. Because then we have a little bit better idea that it might be helpful for you if you're genetically related to someone who's responded to it. So those are the 3 things that you can do to help prepare for your first psychiatric visit. We hope that was really helpful for you and that you can utilize those things and take them to your first visit and make it the most effective visit that you could have. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.